I questions 2. 8. A nurse in the ambulatory care unit is preparing a plan of care for the client scheduled for cataract surgery. The nurse priority the plan of care and most appropriately plans intervention to the address which nursing diagnosis. 1. Self-care deficit. 2. Ineffective tissue perfusion. 3. Disturbed sensory perception. 4. Deficient knowledge. The correct answer is 3. Disturbed sensory perception. 9. The clinic nurse is reviewing the record of a client with a diagnosis of a cataract. Which clinical manifestation is associated with this disorder? 1. Loss of central vision. 2. Opacity of the lens. 3. Eye pain. 4. Inability to identify the color red on the eye examination. The correct answer is opacity of the lens. 10. The nurse is caring for a client with a diagnosis of detached retina. Which assessment sign would indicate that the bleeding has occurred as a result of the retinal detachment? 1. Complaint of burst of black spots and floaters. 2. A sudden sharp pain in the eye. 3. Total loss of vision. 4. A reddened conjunctiva. The correct answer is 1. Complaints of a burst of black spots or floaters. 11. A client has undergone cataract removal but has not had an intraocular complaint done. The client is visibly upset because her vision is blurry. Which approach would the nurse take to provide emotional support to the client? 1. Explore the meaning of new permanent vision loss. 2. Determine whether any relatives have lost vision permanently. 3. Explain that vision will improve with adjustment of opaque lenses. 4. Reassure the client that disability benefit definitely will apply. The correct answer is 3. Explain that vision will improve with adjustment of opaque lenses. 12. The clinic nurse is preparing to care for a client who will need to ear irrigation to improve impact serum. Which of the following will the nurse avoid when performing the irrigation? 1. Position the client to turn his or her head so that the ear to be irrigated facing upward. 2. Warm the irrigating solution to temperature that is close to body temperature. 3. Direct a slow steady stream of irrigation solution toward the upper wall of the ear canal. 4. Position the client with the affected side down following with the irrigation. The correct answer is 1. Position the client to turn his or her head so that the ear to be irrigated is facing upward. 13. The client reports to the emergency room complaining of the redness and pain of lower eyelid. The diagnosis of photoreum is made and the nurse provides instruction to the client regarding measures to treat the disorder. Which statement, if made by the client, indicates an understanding of these home care treatment measures? 1. I should apply cool compress to the eye 3 times a day. 2. I should apply warm compress to the eye for 15 minutes 4 times a day. 3. When the hydrolium comes to head, I should try to press it, make it open and drain. 4. Antibiotic ointment will not apply this condition. The correct answer is 2. I should apply warm compress to the eye for 15 minutes 4 times a day. 14. The client arrives in the emergency room following automobile accident. The client's forehead hits steering wheel and hypoma is diagnosed. The nurse places the client in which position? 1. Flat on the bed rest. 2. Semifocus on the bed rest. 3. Lateral on the affected side. 4. Lateral on the unaffected side. The correct answer is 2. Semifocus on bed rest.